This is the Allurion Program patient journey. We have a range of recommendations of what to cover at each step, and you can get more information from your Allurion sales representative. But let me take you through an overview. During your pre-placement session, which might occur between 2 and 4 weeks before placement, here's a summary of what we recommend you cover. Number 1, spending time getting to know your patient, building rapport and their confidence. You'll need to have a full understanding of their lifestyle, preferences and needs to be able to provide a customised programme. Understanding what motivates your patient on their Allurion journey is so critical to help you understand your patient and to be able to weave in powerful reminders along their journey. For example, if your patient wants to improve control of their type 2 diabetes, or wants to improve their chances of becoming pregnant, or has a wedding on the horizon, weaving in reminders and references to what motivates your patients will help you to provide accountability and inspire them when they face challenges along the way. Number 2, you'll need to educate your patient on what to expect during their Allurion journey, including what happens on placement day, the need to adapt their diet for their first week, and management of common symptoms and of course realistic expectations. Number 3, you'll need to introduce the approach you'll take together to support their weight loss. Will you support them to follow a meal plan or agree that tracking and sticking to a certain calorie goal is the right approach? You can reassure your patients that you can adjust and adapt their program along their journey to meet their needs. Number 4, you also need to ensure all patients are advised on the importance of preserving lean body mass during their weight loss journey and how you're going to help them do that with higher protein intakes and resistance activity. These pre-placement sessions are so important, ensuring your patients are not only well informed, but feel confident, supported and inspired about their journey to come. During these sessions, most importantly, focus on preparing your patients well for what happens in their first week. To prepare for placement day, ensure that your patient adheres to their medication prescription. Ensure that they consume only clear liquids for 8 hours prior to placement and stop these clear liquids 2 hours prior to placement. On the day of placement, it's vital that you or your patient coordinator sets the patient up with their virtual care suite, the app, their health tracker and connected scale, and that they take their first weight in clinic with you on placement day. There's an excellent video to help show you how to do this called Setting Up Your Patient on their Virtual Care Suite, and this can be found in the 4C Hub, our online resource centre. Together, this suite of virtual tools helps enhance the patient experience, tracking their activity, sleep, and changes not only in their body weight, but composition too. This is an easy-to-use platform for the patients to track and reflect on their progress, and importantly, to interact with you. In your patient's first week post-placement, this time is all about helping the body to adapt to the balloon. And we need to adapt a patient's diet because consumption of solid food may make symptoms worse while the body adapts. The goal of the first few days is simply adaptation to the balloon. It's a transition period. Dietitians should proactively check with patients along each stage of their diet progression, supporting them to progress, managing their symptoms and reassuring them to reduce any anxiety that they may feel, and importantly, referring to their physician if needed. We know this week, in fact the first few weeks on the Allurion journey is so important, and high quality, responsive care from you in these first few days can make all the difference. It's important to note here that supporting patients with the Allurion program is different from bariatric surgical care. The 2 main reasons are that diet progression after placement can be much quicker than following surgical or endoscopic bariatric procedures. And the relatively shorter length of treatment for Allurion patients versus bariatric surgical lifelong care means that each and every day counts on the Allurion Program. You will get more information on diet progression, which includes phases of clear liquids, soft food, and then introduction of solids from your Allurion representative. Transition through each phase is really led by the patient's symptoms, with you supporting them at each step. During your patient's first week post-balloon placement, it's important that you support them to stay hydrated. Reduced fluid intake around placement day, symptoms and required changes to eating behaviours that separate eating and drinking might all contribute to the risk of dehydration. So ensure that all of your patients come to placement day well hydrated and that you've made a plan together with them to help them stay hydrated in those first few days. Some patients might only be able to tolerate a few small sips, just a tablespoon at a time, but start there and progressively build up. During your patient's balloon placement period, there are some essential eating behaviours that they need to adopt to reduce the risk of adverse events and symptoms and to optimise their comfort. So you'll need to advise your patients to eat at a slow pace. Take time chewing each mouthful and chew their food thoroughly. Avoid eating and drinking at the same time, so have a drink half an hour before and half an hour after meals. Take a break between each mouthful so that they can assess feelings of fullness and stop eating or drinking at the first sign of fullness. Now, these pieces of advice are really important for all patients, and it's often helpful to reiterate these throughout their journey. In terms of symptoms, you will see a variety of patients. Some patients have no or mild symptoms, and others may experience a few or more intense. This is all normal. There is an expected response to having the soft balloon in the stomach. Common symptoms experienced by most patients include nausea, vomiting, reflux, some abdominal discomfort, feelings of intense fullness, and they may experience constipation. Now, for most patients, these are mild to moderate severity and subside quickly, typically within 3 days to a week. Your Allurion representative will provide more information on the conservative management of these symptoms, and you can find more on our 4C Hub. It's likely that you'll need to provide different advice for different patients. It's important that you're aware of when to refer to the physician. This is really important. If you have a patient with any unexpected symptom, such as fever, severe pain or GI bleeding, persistent severe vomiting, you must refer to the physician immediately. If you have a patient with any severe symptoms, or if symptoms return any time during balloon residence after having completely resolved after week 1, place your patient on a liquid diet and refer to the physician immediately. It is essential that you ensure you familiarise yourself with all the potential symptoms, conservative management solutions, and the triggers to refer to the physician before you support your first patient. It's really important to set clear and reasonable expectations with patients, not only on their potential results, and you may want to use the evidence-based range of 10 to 15% total body weight loss, but on the symptoms they may experience and the commitment to lifestyle change that's needed. The Allurion balloon is an effective tool to help patients make changes in their lifestyle. The balloon increases satiety and reduces the feelings of hunger, so your patients can achieve greater results with less struggle. But you can't rely on the balloon alone to deliver sustained behaviour change and weight loss. Your programme is essential to support shifts in knowledge, skills and habits, so your patients can learn how to maintain their weight losses over the longer term. The balloon is not a magic bullet that leads to weight loss by itself. It's a tool that helps make the journey for lifestyle change easier.